Hello, I'm Carrie Owen Pleats, Regional President of Kaiser Permanente Northern California. I'm joining you today in my role as Chair of the Board of Governors for the American College of Healthcare Executives. I am so proud to represent both organizations and to share our pandemic responses. Like this event, ACHE's own Congress on Healthcare Leadership is our organization's largest annual gathering. In 2020, we canceled the event outright as our members and healthcare leaders nationwide responded to the superhuman challenge of caring for patients in the midst of a global pandemic, the size and scale of which we could not have imagined only a few months before. In those early days, I spoke frequently with ACHE's CEO and new IHF President Deborah Bowen, my colleagues on the board, and with ACHE members and fellows across the country. It was clear to me healthcare leaders were eager to connect and learn how their peers were navigating the pandemic. ACHE quickly responded to meet those emerging needs. We held webinars with leading system CEOs where thousands tuned in to learn from others about frontline insights and tactics. We developed entire issues of our member journals and magazines dedicated to pandemic response and created new member support resources with universities, associations, and our premier corporate partners. We provided virtual sessions delivered nationally by our 77 local chapters, expanding reach to more than 18,000 attendees to date. A shining example includes our all-virtual 2021 Congress on Healthcare Leadership, which brought together 9,200 leaders from various disciplines, sectors, and geographies. IHF joined us to deliver sessions on the evolving global healthcare landscape. In addition to my role as chair of ACHE, I have also had the rewarding challenge of leading Kaiser Permanente Northern California region over the past year. I'm incredibly proud of what Kaiser Permanente has accomplished in support of our members and communities throughout this pandemic. When demand for COVID-19 testing far outpaced supply in early 2020, we moved quickly to expand our testing capabilities. The expansion included the accelerated construction of a new $14 million testing lab in Northern California. The lab, which opened in May of 2020, was built in less than 2 months and can now process up to 20,000 tests per day. Early in the pandemic, with so many unknowns about the virus and the California shelter-in-place order in effect, Kaiser Permanente moved swiftly to offer our members telehealth appointments as an alternative to in-person care. From March to November of 2020, our physicians conducted nearly 3.7 million video visits, a remarkable number compared to just around 100,000 for all of 2019. This exceptional work is a terrific example of Kaiser Permanente's commitment to provide our members and patients with exceptional care and service, while also supporting COVID-19 mitigation efforts to combat the spread of this virus. The experience and knowledge we've gained together in the last 18 months will help carry us into a brighter future. As ACHE worked this year on our strategic plan, we heard from executives across the country on the issues they face each day. We know the safety of both of our patients and our workforce remains a top priority. You can visit ache.org/safety to learn more about creating a zero-harm culture of safety in our organizations. We know building resilience in our workforce and agility in our organizations will be key to solving so many challenges, from disaster preparedness to burnout. And we know leading through a lens of health equity across the care continuum is vital to building healthier communities for all. From all of us at ACHE, thank you. We are incredibly grateful to leaders like you for the dedication and service you've shown your patients, your colleagues, and your communities. We're proud to be a part of IHF's 44th World Hospital Congress and look forward to many more years of partnership to come.